Good morning, folks. This is John Adamson, the Rehab and Documentation Guru. Today, speaking to you from my Suburban, because when you have a large family, you tend to have a Suburban as a backup vehicle. No, I can't fit all my kids in here, but anyway, that's besides the point. Good Monday morning. And today, I'm going to do a little reading from the Resident Assessment Instrument. This won't be a dramatic reading. I don't feel dramatic this morning. But for those of you that are in SNF, and you've been told, perhaps because of the downturn in Part A patients, to pick up Part Bs. And there's a good reason to pick up Part B patients. And this is one thing I elaborate on in my course, and that is what's called OBRA, Omnibus Budget Reconciliation Act of 1987. First came into law, signed it by President Ronald Reagan. And it stipulated that nursing homes were required to keep track of their residents' status functionally. And thus the MDS got created. And one of the things that the MDS was supposed to track was patient performance at regular intervals to ensure that they weren't declining in function. And upon that basis of the regular assessments, you could determine what the care needs of a patient were. And this is from the RAI manual, the most recent version on page 23 of 1,309 pages. It stipulates the following. The OBRA regulations require nursing homes that are Medicare certified, Medicaid certified, or both to conduct initial and periodic assessments for all residents. The Resident Assessment Instrument, RAI, process is the basis for the accurate assessment of each patient, of each resident, I should say. So you heard that, it's the basis. And upon that basis, you build the case to treat patients. So one of the things, and you may already be familiar with this, that you should be doing is quarterly screening your patients. And this should coincide with the regular MDS assessments for your long-term residents. If the patient has a shown decline in a functional area that falls within your scope of practice, then something needs to be done about that. It doesn't necessarily mean that therapy is needed, but it might point to the necessity of therapy. So if you're looking for a basis by which you can determine that, yes, PT, OT, or speech is necessary, the RAI, or I should say the MDS, is a good starting point. So if you're not already having your director of rehab or somebody tracking how the patients are presenting on their regular quarterly MDS assessments, make sure that gets put in place. Medical necessity is determined by, in part, Medicare assessments, and the MDS is a good basis, as this section of the RAI points out. And you may have a good reason to pick up these patients. Now, one of the things you got to keep in mind is if the patient has an MDS decline, then it at least warrants a screen. But a screen, you can't really rule in the need for therapy. I know sometimes you can rule it out, like, oh, the screen, the patient's screen looks about the same as where you last discharged them for therapy. But you really can't rule in the need for therapy. You really need to do a therapy assessment. Maybe you don't agree with that fully, but I really think you need to put eyes on a patient if they've had a decline. At least if the MDS shows a decline, you should probably do an eval just to make sure there's nothing going on that you should not be addressing. Because if the patient's in a skilled nursing facility anyway, they're probably fairly complex as an individual, and likely if they've had a decline and nursing has missed it, not been able to do anything about it, then that necessitates you. So use the MDS quarterly assessments to your advantage to determine what patients might at least need assessment, and then in your evals, do a good thorough job to prove that you truly are the one that's necessary to address the patient's OBRA rights, which is to be maintained at their highest practicable level of function. Anyway, this is John Adamson, the Rehab and Documentation Guru. Please like and subscribe. The more likes, the more subscriptions, the more likely I'm going to get some return on investment for putting out this stuff. Also, So plug there. Also, please, if you have any ideas for future videos, I've gotten lots of suggestions from people and I've been able to address them. Please send me a message via this video or to my email at adamsonenterprises, the number 1, at gmail.com, and I'd love to address any future topics that you like. Anyway, take care, God bless, and have a great Monday.